Hi, everybody. I'm Dr. Bryan Ardis. This is the Dr. Ardis Show. Hope you're having a great day. Hope you enjoy what we're about to present. And I'm very excited and thrilled because not very often do I present on a health topic uh, that I actually had to endure my own suffering through. So this is an entire podcast is all about the natural solutions to a inflammatory condition that the medical profession tells you there's no cure for. It's called gout. Gout, gout. Well, the medical profession to this day still professes there's no cure for gout. I just need to let everybody know here why it is you might be interested in this. If you know anybody who has suffered with gout symptoms, there is absolutely something in common I have with them. I actually suffered from the symptoms of gout for over 10 years, from when I was 18 years old till I was 28 years old, until I learned how to cure myself of gout. And I've never had a gout flare up ever since I was 28 years old, and now I'm 49. So I'm very excited to present to you the natural solutions to gout, because what the medical profession is going to tell you is there's no cure for doubt, for gout, no cure for doubt. Yeah. No cure for gout. All right, so let's dive in. This is going to be a PowerPoint here of what the medical profession professes, what the prescription drugs are that are given to you. You're about to be shocked. Like type 2 diabetes, where they tell you there's no cure. Actually, type 2 diabetes is completely curable with nutrition and diet. So is gout. That's how I fixed it. There was one food. I just had to reduce the amount of ounces I ate, not avoid it. I just had to reduce the ounces that I ate in any serving, and never again have I ever had a gout flare-up. Wouldn't that be miraculous? It was never a prescription drug deficiency. And you should be disgusted from this presentation when I show you the 3 most common drugs prescribed to everybody with gout. Wait till I show you the percentage of people who will have gout flare-ups that are side effects of the drugs, who will have exaggerated in more intense gout flare-ups in any part of their body because of the drug. Which are your only options these are going to give you. All right, the medical profession. All right. Please stick through the end. I'm going to actually walk you through 4 nutrients that are proven, how dehydration is implicated, and what are called high-purine foods, which foods you should be avoiding. The whole list. I'm going to give you a list. I'm going to show you. The list you should start looking at is anybody in your life that's dealing with gout eating these foods. All they have to do is reduce them to any amount like I did, or they can eliminate them and watch their gout disappear. It is awesome. All right. So if you know somebody with gout, you find this presentation beneficial, go to the resources tab of the Dr. Ardis Show, download the PowerPoint presentation on the natural solutions of gout. That's how it's titled. Just download it, the whole PowerPoint I'm about to show you, and then send it to your loved ones by email, text, whatever. It doesn't matter. Or print it out. Give it to them in a booklet. It's great. It's all free at the resources tab at the Dr. Ardis Show. Very good. All right. So here we go. If you're new here, I'm excited that you're here. If you're an Ardis Club member, which you can learn about that at the website. Hi again, and thank you for your trust. We love you and appreciate all you do to support us here at the Dr. Ardis Show. Here's the PowerPoint. Let's bring it up on the screen. Very, very good. All right, so here's natural answers to gout. Just follow along. I'm going to put up PowerPoint slides, and as we go, there's going to be research articles. There's going to be mainstream articles, and you're going to see how we've highlighted the statements we want you to follow. This is everything you need to know about gout. I beat it years ago, 20 years ago. You do not have to live with gout. If I went to a medical professional, they would have told me, you're going to have to live with this forever. There's no cure, which they published, and I'm going to show you. They still say this. That is absolutely crap and a fraudulent statement. But if you use drugs, which I'm about to show you, you will now understand why people with gout who are being treated for gout continue to have gout, because the drugs themselves, I cannot believe these numbers. They are shocking. Just wait. You can scan this QR code, put in your email, and we can notify you of our future events, future podcast, and anything else that we're launching, releasing to educate and inspire you. So how much of a big deal is gout? All right, so this is Elsevier, the Lancet Rheumatology Journal 2024, the global, regional, and national burden of gout from 1990 to 2020. And what are the projections for those with gout till the year 2050? Let's read along. Remember, on the screen, if you're watching, if you're driving, don't be watching. But if you're at home, sitting somewhere, and you can watch the screen, just look at the highlighted statements. It's very easy to follow what I'm reading. I'm going to read these to you. In 2020, just 5-6 years ago, 55.8 million people globally had gout, with an age standardized prevalence of 659.3 people for every 100,000. And that was an increase of 22.5% globally since 1990. So this is a big increase. The total number of prevalent cases of gout is estimated to reach by the year 2050, 95.8 million. So just stay looking at the screen. Look at the first underlined statement. In 2020, there was 55.8 million people in the world with gout, the whole world. In the next 20-something years, 30 years from 2020, by the year 2050, they're telling you 95.8 million people in the world will have gout, is what they expect. Just so you know, this is evidence that the medical profession sucks, and so does the pharmaceutical industry and all the research associations looking for the cause of gout and eradicate it. This is them claiming and telling you they suck at resolving gout issues and solving it. So you might want to hang out with us because they don't know what they're doing. I'm about to show you. Here's the Cleveland Clinic. Isn't that amazing? These are medical statistics. They're telling you we really suck at helping people resolve gout and cure gout. It's going to be 20 million more people, actually 50 more million people are going to have it in the next 30 years. That's how bad we are at fixing gout. All right, here's the Cleveland Clinic, one of those we don't know what we're doing when it comes to gout, and we don't know how Dr. Ardis fixed his own gout. Here you go. Gout is a painful form of arthritis when your body has extra uric acid, which your liver makes. Sharp crystals can form in your joints, usually a big toe beginning. And that's exactly for me. It was always my right big toe joint. Flare-ups of symptoms like pain and swelling come and go in periods called gout attacks. Stay with me. It's not just big toe. What is gout? Further in the Cleveland Clinic article, gout most commonly affects your big toe joint, but it can affect other joints, including your knees, ankles, feet, hands, wrists, and elbows. I actually had patients, anytime they would drink alcohol, their knees with gout would swell up to like 3 times the normal size within 24 hours. And it would take a week for it to resolve, or it wouldn't resolve if they kept drinking alcohol. Just so you know. Now, when I had gout, just so you know, I never sipped alcohol in my whole life. So that was not the cause of my big toe pain, which is the most common first symptom of gout. But gout will progress and can become gouty arthritis throughout the entire body in any joint. Gout symptoms come and go, and reoccur in episodes called flares or gout attacks. And it's all based on what you eat. I guarantee it 100% you're going to learn that today. Gout risk factors. They're going to tell you nothing about food here from the Cleveland Clinic. And I'm telling you 100% of the time, gout is caused by the food you eat. Gout can affect anyone. Men are 3 times more likely to develop gout. Women usually don't experience gout until after menopause. People with certain health conditions are more likely to develop gout, including those who are overweight or obese, congestive heart failure, diabetes, hypertension, kidney disease, blood cancer. You're more likely to experience gout if you, 1, eat a lot of animal proteins. Good, they finally got there. Especially animal flesh, shellfish, and foods that contain organ meat. I'm going to show you. Drink alcohol regularly, which I just told you. If you know anybody with gout, they need to stop drinking alcohol right now. They don't have to avoid animal proteins. But I, Dr. Bryan Ardis, 20 years ago, learned from an endocrinologist about the top 3 foods that lead to higher uric acid amounts in the bloodstream to lead to gout symptoms. And all I did was look at my own life in about 5 minutes. And I was like, well, I don't even eat one of the 3. So of the other 2, which one do I eat the most of? And all I decided to was reduce one by 2 ounces. 2. And it happened to be steak. I decided I'm going to cut my 12-ounce steaks I usually eat down to 10. And imagine my shock. I've never had a single gout flare ever again. Ever. And these things were debilitating to walk, run. I was a basketball player. It really hurt to run on hardwood floors with gout flares. It was awful. All right, good. Here we go. But look at this with Cleveland Clinic. You're more likely to experience gout if you are on a diuretic medication or what is called a water pill. So Lasix, hydrochlorothiazide for blood pressure, you name it. If you're on those drugs, they know it causes gout. If you're on an immunosuppressant drug prescribed to you, prednisone, hydrocortisone, any steroid ever, Broncos, inhalers, corticosteroid inhalers for asthma. Those are immunosuppressants, by the way. If you're on those prescriptions, any steroid of any kind, you are more likely to experience gout because the drugs cause gout flare-ups. You're about to learn. Can gout be cured? Cleveland Clinic, the medical profession I just told you earlier in the beginning of this broadcast, there's no cure for gout, end quote. So if you have gout, why would you go see these people? They don't even know how to fix it. They tell you there's no fix for this. All of a sudden in your 30s, 40s, your big toe hurts. and you want to run off to your MD, I'm telling you, they don't know how to do this. They have no idea what the hell they're doing. They do not know how to fix this. So they're going to give you drugs, and the drugs aren't the cause. In fact, the drugs can cause gout. You just learned. All right, so here we go. Gout medication. NSAIDs, over the counter. NSAIDs like ibuprofen and naproxen can reduce the pain and swelling during a gout attack. True. Colchicine, I don't even know, is a prescription medication that can reduce inflammation and pain if you take it within 24 hours of a gout attack. I just don't know that name. Corticosteroids, like I just mentioned, are prescription medications that reduce inflammation. I want to go back here. Did you know that steroids are immune suppressants? They're telling you here, you're more likely to experience gout, Cleveland Clinic, if you take an immunosuppressant, which is what they're telling you here is corticosteroids recommended for gout. Your provider might prescribe medications to help lower uric acid levels. The most common medications that lower uric acid include allopurinol, febuxostat, pegloticase, and probenecide. This infographic from gouteducation.org. Many without gout don't understand their disease. 1 in 2 people don't know gout can affect both men and women. 6 in 10 falsely believe that gout only affects the feet and toes. That is not true. 4 in 10 people falsely believe that gout is a disease that comes and goes. Now, it's actually a nutritional problem. You're eating the wrong crap. 6 in 10 people do not know that gout is a form of arthritis. Well, now you do. What has been published about these gout drugs that we just showed you the most commonly prescribed? Allopurinol, known as the brand names Xyloprim, Luperin, and Alloprim. What is allopurinol? Look at the bottom. This is from drugs.com. Allopurinol belongs to a class of medications called xanthine oxidase inhibitors. It works by reducing the production of uric acid in the body. Your body only makes uric acid in the liver, so this is affecting your liver cells. High levels of uric acid may cause gout attacks or kidney stones. True statement. This is what it looks like in a pill form. What are its common side effects? All right, everybody out there, if you have a loved one, after human trials for allopurinol, medical doctors have reported we put our gout-suffering patients on allopurinol, and this is what happened after the FDA approved it. Heart failure from doctors who have prescribed it have reported that back to the FDA. People have had heart attacks. Cardiorespiratory arrest, their heart stopped. They stopped breathing. Hypotension, cardiovascular disorders were created by the drug to address gout. Thrombophlebitis, amazing blood clots all over the body. Ventricular fibrillation, pericarditis, inflammation of the sac your heart is inside of. ECG abnormality. What? So the drug for gout can cause abnormal readings in your heart rhythm or in your brainwave activity, and they can prescribe new drugs for that. You're welcome. What about skin reactions from allopurinol for gout? If they prescribe this drug that's FDA approved, just want you to know up to 10% of all people will experience rash, including, look at this, after the FDA approved this drug, allopurinol for gout and uric acid levels. Look at what I highlighted here. Many people around the world write into the Dr. Ardis Show and want to know, what do you do for lichen planus and what causes it? Did you know allopurinol, when prescribed by MDs by itself, is known to cause and has been reported to the FDA to cause patients with gout to develop lichen planus? And they call it a lichenoid drug reaction. Did you know that? So all of you out there, you might want to start looking at medications. If you were put on a prescription medication, then later you or a loved one started developing lichen planus and diagnosed with that. Oh my God, now you have learned that drugs are known to cause lichen planus. It is a poisoning side effect. All right, now endocrine, this is hormones. Did you know allopurinol for gout? Could you imagine your big toe hurting and you're a man? It happens more often to men, as we just showed you. Could you imagine after the FDA approved this for gout, your man, husband, dad, brother, son is given allopurinol, and then they develop from the drug what is called gynecomastia. Do y'all know what gynecomastia is? That's when men develop breasts. Ask your doctor when you have gout and they prescribe allopurinol if you having boobs as a man is right for you. And now that I'm thinking about it, maybe this is an answer for transgender males who want to become a woman. Just take allopurinol. They've known that it's created boobs in men. There you go. You don't need the hormone stuff. Allopurinol will jack up your hormones for you. GI, up to 10% will experience nausea and vomiting from allopurinol, and enlarged abdomen and gastrointestinal bleeding. Ask your doctor if that's right for you. And then after the FDA approved allopurinol, look at this. Liver failure has been reported by medical doctors after putting their patients on it. I just want y'all to know, liver inflammation or disease is the cause of gout from the food you're eating. The liver makes uric acid. If you're making too much, you're eating foods. It only comes from the liver, and this causes liver problems. Liver failure has been reported after putting patients on allopurinol. How is that going to help you with a liver problem called excess uric acid? Then you see AST or ALT increase right after liver failure is a published side effect after the FDA approved this for gout. What is AST and ALT? Inflammation markers of liver toxicity. Oh, this is going to exacerbate your gout problems, by the way. Now let's look at blood side effects. After the FDA approved allopurinol for gout, hemorrhaging has been reported by medical doctors. That's bleeding internally or externally. You're just bleeding out. You're going to have a stroke. And then look, I underlined disseminated intravascular coagulation, DIC. Do y'all know what that is? Blood clots all over the body in little bitty vessels called capillaries. And during COVID, you saw people had their toes amputated, fingers amputated when they turned purple and black and blue from little bitty blood vessels in their joints and their fingers and toes. That is what DIC is. Allopurinol causes blood clots. And now for metabolic, look at this. Metabolic, meaning your body as a whole. The FDA has been notified by medical doctors that when they put their gout patients on allopurinol, look at what it says. It has been reported back to the FDA that allopurinol caused acute attacks of gout. Well, I just showed you its impact on the liver, so now you know why. Ask your doctor if more intense right now, which is the word for acute, right now, very sudden attacks of gout are right for you when they're giving you a drug for gout. Then your nervous system, allopurinol is known by the medical doctors who have prescribed it. They've reported it back to the FDA since the FDA approved it. They know that it causes generalized seizures, allopurinol. Oh my God. Strokes have been caused by allopurinol for gout. Imagine your big toe hurts. Now you have a stroke. Is that better? Is having seizures now better than just having your big toe hurt? Look at the rest. Vertigo, you'll get dizzy. Optic neuritis. Eye pain? No, thank you. Foot drop, that's paralyzed feet. Oh my goodness. Amnesia. How many of you would like to forget your gout? Maybe you should get the prescribed allopurinol. Tinnitus. Anybody wishing they had deafening, roaring, ringing in their ears? Tinnitus, however you want to pronounce it, is caused by allopurinol and has been reported to the FDA by medical doctors prescribing it. Those of you who did not like your taste and smell, you don't like it, you wish you had COVID again, so you stopped tasting and smelling things. Taste loss or perversion is caused and known and reported to the FDA being caused by allopurinol for gout. So if you have big toe pain and you don't want to taste anything anymore, just take allopurinol. It's been reported to do that. What about your eyes? Look at that. Iritis, retinitis, conjunctivitis, pink eye. Anybody? Sounds like a better. Increased alkaline phosphatase and septic shock. Oh, great. Ask your doctor if shock is right for you, septic shock. And then for the kidneys, everything the liver makes, including uric acid. The liver produces uric acid from the food you make. That uric acid is floating in your blood and ends up in your kidneys, and your body converts uric acid into what you call urine. If the kidneys can't break down the amount of uric acid you have, you can develop kidney stones, kidney malfunction, you name it. Allopurinol, which is being prescribed to people with a liver issue called gout. From making too much uric acid, their kidneys can't process into urine, and those crystals are now going with gravity to your feet to create big toe pain like it did to me years ago and for millions around the world right now. Did you know up to 10% of all people in research studies giving people with gout this drug, allopurinol? That allopurinol, the drug to address gout, up to 10% of everybody in the clinical trials actually experienced renal failure, which is another word for kidney failure, from allopurinol. Or it reduced their efficiency to actually produce urine, which increases uric acid levels. Your body's kidneys convert uric acid into urine. If it can't do that because it's insufficient, which allopurinol causes 1 in 10 people on it to develop insufficient kidney function or kidney failure. Kidney function abnormality, urinary tract infection. How is this better? This is why so many people can develop acute gout flares. Respiratory failure or insufficiencies reported since the FDA approved allopurinol. So ask your doctor if acute gout attacks and kidney failure are right for you when they prescribe allopurinol. Now let's look at the next drug. This is probably the most common one people are aware of. Its brand name is Uloric. You see it underlined there, Uloric. And febuxostat is its generic name. Febuxostat reduces the production of uric acid in your body. A buildup of uric acid can cause gout symptoms. This is what it looks like. It comes in a pill. You've probably seen commercials for it. Your loved one's probably on it. Warning. This is a black box warning from the FDA. They approved the drug for gout, but then they had to publish this warning. Cardiovascular death from urolic. Gout patients with established cardiovascular disease treated with urolic had a higher rate of cardiovascular death compared to those treated with allopurinol, the drug we just reviewed. Did you know that? Ask your doctor if cardiovascular death is right for you when they recommend your Uloric. Sorry, I mispronounced that. Uloric. Uloric. Cardiovascular death. Can you believe that FDA approved this first warning label? All right, so those with Uloric for metabolic, look at this. When you prescribe the most brand name, well-known drug, put on commercials, ask your doctor if Uloric is right for you. Look at what the research studies proved was the side effect of Uloric when it comes to gout. In clinical trials, when the FDA approved this drug for doctors to prescribe to you and your loved ones with gout flare-ups, from the research studies alone, they found when they gave Uloric to anybody, it caused gout flare-ups in 43% of everybody they gave the drug to. Oh my God, what? Wait. What? Almost half of everybody you gave the drug to got gout flare-ups from Uloric. Okay. You're going to learn from this presentation how it is people with gout being treated medically for gout continue to have damn gout. The drugs cause gout flare-ups. And this is the second of the 3 or 4 most common drugs prescribed to gout. You're about to see the numbers. Some of them are worse than this. 43%. Ask your doctor if more gout flare-ups are right for you when they prescribe this. Then notice it's also published to cause an up to 1% of all people hyperlipidemia, too much cholesterol levels, and then diabetes is caused by it, Uloric. How about psychiatric? Look at this. After the FDA approved it, it has been reported to the FDA by medical doctors around the country that when I put my patient on Uloric for their big toe pain called gout, they developed anxiety disorders and now have been diagnosed with anxiety disorders, depression, irritability, panic attack disorders, and personality changes. Schizophrenia, anybody? Ask your doctor if that's right for you. So ridiculous. Gastrointestinal, you'll see gastritis, abdominal distension and pain, diarrhea. Let's go to hepatic. This is the liver. The liver makes uric acid from the food you eat. Look at this. 1 in 10 people on Uloric in the clinical trial saw ALT greater than or equal to 3 times the upper limit of normal. Inflammation of the liver leads to increased uric acid production. This is why you will see below, after the FDA approved this drug and after the trials were over, look at what it says down there below. The FDA has been notified by medical doctors prescribing Uloric, the FDA approved, that they know causes 3 times higher inflammation in the liver than before, 43% more gout attacks in people with gout. Look what it says down there. The FDA has been notified after you approved this drug that some of our patients on Uloric experienced liver failure called hepatic failure, some fatal. They died from the drug. They didn't die from gout. They died from the drug. Ask your doctor if liver failure and death are right for you with Uloric, or if 43% more gout flare-ups are right for you. People who have gout, who are on prescription drugs for gout, have continued gout flare-ups. Trust me, I'm a testament. I've never been on any of those, and I cured all my gout flare-ups. I've never had another one. But if I went on those drugs, I would still have gout flare-ups to this day. And they would tell me this is an incurable disease. Yeah, it is incurable as long as you keep causing it. Nervous system from Uloric. Oh my God, look, Guillain-Barré syndrome's been reported. That's literally modern day polio. your right leg becomes paralyzed or left leg, then the same side arm will go paralyzed, then half your face, it looks like Bell palsy. And some people, this is permanent. Transient ischemic attack, do y'all know what that is? TIAs? You should go look it up. And then ask your doctor if heart attacks are right for you. That's death of heart tissue. TIAs, caused by Uloric. After the FDA approved it, cardiovascular wise, read it with me together out loud. Let's make a song out of this so you can't forget it. People remember songs. Okay, Uloric for gout. Your big toe hurts, you get put on Uloric, the most common prescribed gout drug. I want you to notice what medical doctors have reported back to the FDA since it was FDA approved. Major adverse cardiac events, including cardiovascular death, non-fatal myocardial infarctions, heart attacks, strokes, and cardiovascular death have been reported to the FDA from Uloric. My patient's big toe hurt. I put him on the Uloric like the FDA approved, and my pharmaceutical rep told me to, and my patient died. Better let the FDA know. Gout did not kill them. For the skin, anybody out there worried about vitiligo, depigmentation of your skin, darker patches on your skin, age-related spots as they call it, or sun spots on your skin? Did you know Uloric causes skin discoloration and altered pigmentation? Did you know Uloric has been reported by medical doctors to the FDA that it has caused shingles in their patients? And I underlined herpes zoster virus. Herpes zoster is what shingles is. Uloric, the drug, caused patients with gout to develop shingles. And it was a side effect not of gout, of the drug. And that has been reported back to the FDA. Arthralgia, joint pain, muscle pain, arthritis, muscle spasm, and up to 1 in 10 people. Joint pain. Remember, everybody, go back. Remember, everybody, gout is an arthritis. Notice here, 1% of people developed arthritis just from Uloric. This is your hematological. You'll see splenomegaly, enlargement of your spleen, white blood cell decrease. That's a reduced immune system. Thank you very much. Platelet count decrease. That's not good. Hematocrit, hemoglobin, hemorrhaging, blood effects of Uloric. Oh, if men get gout most often and most men are being prescribed Uloric, did you know it's caused in 1% of all people they give it to? Erectile dysfunction. Now you're going to go to a low testosterone clinic, get put on testosterone that benefits big pharma. Then you're going to be told you need Viagra, Cialis, you name it, for your erectile dysfunction caused by Uloric. And then look, for all men, remember, gout affects men the most. If this was me and I was put on Uloric the last 25 years, 30 years, imagine this. Look, it says prostate-specific antigen increase. Did you know Uloric for gout? My big toe hurts, doc. They prescribe me Uloric. I go to CVS and Walgreens. And then 6 months later, you're getting an evaluation done, wellness check done, insurance check, blood test, blood draw, and they find your PSA level has increased. Then they're going to tell you, oh my God, you might have cancer of the prostate. Did you know Uloric causes PSA to go up? And that is not a cancer issue. It's a drug toxicity of the prostate. Urine output increase or decrease, as they have seen, which is a prostate inflammation sign or symptom. Ask your doctor if erectile dysfunction and increased PSA threatening enlargement of your prostate and prostate cancer diagnosis is right for you with Uloric. Respiratory, you'll see there bronchitis, cough, dyspnea, shallow breathing. Upper respiratory tract infections are all side effects of Uloric. Now let's get to the third drug most commonly prescribed for gout. Pegloticase, brand name Cristexa. Pegloticase is used to treat chronic gout, they say, at drugs.com. That's what it looks like. It's a liquid, looks like it's an injectable. Now, the black box warning from the FDA about this gout drug is anaphylaxis and infusion reactions have been reported to occur during and after administration of pegloticase. There you go, anaphylactic reaction. Make sure you have an EpiPen ready if you're going to get this drug. For the blood, I want you to read this. Read it with me. Read it with me. You're not going to know what this is, and that's okay. I didn't have to look it up. Just wait till you see what the definition is below. Pegloticase, which is actually FDA approved for gout. After the FDA approved it, it has been reported that glucose-6-phosphate dehydrogenase G6PD deficiency, associated hemolysis, and methemoglobinemia is a side effect of this drug, pegloticase. Now, you don't have to know what that is. Let's just read below what the hell they're talking about. Just read the first two words. Life-threatening glucose 6-phosphate dehydrogenase deficiency associated hemolysis has been reported in patients treated with this drug. Okay. My big toe hurts, doc. Here, you should take this pegloticase. This pharmaceutical rep came in, told me it was really good. I get a high commission. You should take it. Did you know medical doctors, having prescribed that before you, MD, have already reported it has created life-threatening scenarios in their patients? The drug is life-threatening through this deficiency called glucose 6-phosphate dehydrogenase deficiency. You don't even know what it is. Just know the drug has been known and reported to threaten your existence. Nausea and vomiting in up to 12% of all people on the drug in trials. 10% or more. Look at this. Pegloticase antibodies. 92% of people saw an increase on this drug of anti-pegloticase antibodies. I just want you to know the human body and the people given this in human trials, they found 92% of all people given this drug, their own bodies produced antibodies to destroy the drug. Well, how good is it going to be to help you beat gout if your body's making antibodies? 92% of all people, 9 in 10 people will develop their own antibodies to destroy the drug's ability to help you beat gout. Ask your doctor if a sucky drug is right for you. Hypersensitivity, anaphylaxis in 1 in 10 people. Have your EpiPen ready when they give this to you. All right, everybody. I told you it's even worse. Okay. In the clinical trials for this FDA-approved drug called pegloticase for gout. Look at this. In the clinical trials, these are people without gout. They just want to know what happens to you when you take this drug. These are healthy people in the human clinical trials. 77% of people develop gout. Gout flares from the drug for gout. When I said earlier, your loved ones who suffer with gout, who are a part of their Facebook group, your support groups where you all talk about your victimhood and having gout, blah, 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 and you're on these drugs, the drugs cause gout. There's only one reason why you keep showing up in these support groups complaining about your pain. The drugs cause gout, people. This is how they keep you keeping gout. This is why they tell you there's no cure for gout. Because when we treat gout, the drugs will give you cause gout. In 77% of people, you will develop gout. Look at this. I'm going to read together. Look, they even go further to tell you how many people reported it. The frequency of gout flares was 74%, 81%, and 51% for patients receiving 8 milligrams of this drug every 2 weeks, 8 milligrams every 4 weeks, and the placebo, respectively. Ask your doctor if 8 milligrams is right for you so you can experience 74% gout flare-ups. If you want to ensure you keep your gout, please go ask your doctor for this. All of you out there who are victims, you know people who have gout and they love complaining about their gout. They love owning that they're a gout victim. Tell them to make sure they get on this drug. Make sure this is one of the drugs they're on so that they can continue to find their ego being stroked in their victimhood. Man, it sucked. I hated having toe pain. You walk and every step hurts and kills you. Shoots pain up from your toe to your brain. All right, local side effects of this drug, pegloticase. Infusion reactions up to 26%. Now let's read. These symptoms overlap with those that constitute anaphylaxis. So 26% of people in the clinical trials experienced anaphylaxis. You might want to make sure you have an EpiPen when you first try this drug. What about cardiovascular wise? Look at this. Chest discomfort and chest pain in up to 1 in 10 people. All right. If 77% of you getting gout flares caused by this drug isn't enough to get you to second guess your doctor prescribing this drug, look at this. 2 cases of congestive heart failure exacerbation were reported among patients receiving 8 milligrams every 2 weeks. 4 patients were reported with congestive heart failure exacerbation from the drug. So they know that. All right. So what does Dr. Ardis recommend for gout? I'm excited to share with you. One of my favorite nutrients on the planet is called Guggul Resin Extract. This is from the California College of Ayurveda Medicine. Guggul, a deep dive into ancient literature and modern research. What does this have to do with gout? Remember, at the Dr. Ardis Show, we have Guggul Resin Extract at these doses here. K-Assure Guggul is best for inflammatory, painful, red, and swollen arthritis. as well as sciatica, tendonitis, and polymyalgia. Guggul Resin Extract. It is also useful in cases of gout, removing obstructed vata that causes pain, cooling the blood, and scraping out uric acid and crystalline deposits affecting your joints. You should be on our Guggul Resin, which I take every day. I didn't have this when I reversed gout, but if you've got patients or loved ones with gout, they want to prevent it. This helps to clear uric acid crystals from your joints. How amazing is that? The appropriate dosage of Guggul is 500 milligrams to 1 gram 3 times per day. In our case of our Guggul Resin Extract, you would just need 1 capsule 3 times a day to get to those doses. Guggul is a broad spectrum remedy for gout, sciatica, arthritis, edema, and pain in the lower abdomen and bladder areas. And they report again in this article, 500 milligrams to 1 gram 3 times per day. It is best for chronic arthritis. It is used for sciatica, rheumatism, gout, arthritis, amenorrhea, obesity, painful menses, amenorrhea, hemorrhoids, worms, fistula, and impotence. Remember the erectile dysfunction thing? Great. You might want Guggul Resin Extract. Now, this is in the same article. This is a second plant by name producing Guggul resin. In the nervous system, Guggul can be used as a nervine tonic and analgesic in neuralgia. It can reduce pain in neuralgia, neuropathy pain. Guggul works for. It also helps reduce pain in rheumatoid arthritis, sciatica, facial paralysis, like the Guillain-Barré syndrome I just told you about. That's a side effect published by the Drugs for Gout. Hemiplegia, one-sided paralysis. That's Guillain-Barré syndrome. And I quote, gout. Guggul is good for gout. So ask your doctor if Guggul is good for gout, because here's some research studies to prove it, not just that Ayurvedic College of Ayurveda summary of how it's been known to be used for years in folk medicine. Clinical evaluation of Amrita Guggul in the management of gout. In total, 378 diagnosed gouty arthritis patients were selected, irrespective of their sex and age group, from 20 to 60 years old. Their uric acid levels were measured and taken for the assessment in their lab evaluation before the study. In Group A, they gave Guggul, aromatic Guggul. 68% of patients were assessed under marked improvement. So after the study was over, in the marked improvement, significant improvement in gout symptoms, 68% reported in the group were in the marked improvement group. Almost 70% of them saw an improvement. In Group B, where they got Kishora Guggul, it was only 42% improvement. The study reveals 68% relief in pain, which is what's debilitating with gout. 68%, y'all, not 77% of gout flare-ups with that last drug I just showed you. 55% relief in swelling. Wow. 76% relief in stiffness. 62% reduction in overall uric acid level, which were statistically highly significant results. You don't see that very often with natural medicine, where a medical researcher, an author, will state it was statistically highly significant. Ask your doctor if Guggul is right for you. We're not even done. I'm going to show you another research study on Guggul in the management of gout, an open label, single arm prospective study. And this is from, let's just quote it correctly, Research in Ayurvedic Sciences Journal. And what they find? A total of 68 patients meeting the diagnostic criteria for primary gouty arthritis. The treatment protocol consisted of giving them 1,000 milligrams of Guggul and 10 grams MR twice daily after meals with lukewarm water for 12 weeks, followed by a 2-week follow-up period. After 84 days of the study, statistically significant changes were found in clinical symptoms, joint pain, and the parameters they were evaluating, which included physical functioning, being able to move around, emotional well-being, and social functioning and general health. They saw improvements in all those. The average uric acid level at baseline was 7.39. That was their measurement before the study, before giving them Guggul, which reduced to 5.35 after treatment, and that was significant. And during the trial period, I highlight this. I just went through the side effects from the drugs the FDA approved for drug companies to give you for gout, to keep you having gout flare-ups. Look at the side effects from this study from Guggul with gout. No side effects were reported. Ask your doctor if Guggul is right for you, because it is. Despite variations in demographics such as gender, socioeconomic status, and age groups, The absence of side effects throughout the trial period further supports the safety profile of these formulations. These positive outcomes advocate for the use of Guggul in the treatment of gout, offering patients a well-tolerated and beneficial therapeutic option. Ask your rheumatologist if Guggul is right for you. We've got an organic, all-natural Guggul Resin Extract at thedrardisshow.com. Go get it. On the bottle, you see I recommend 1 capsule every day. For those with gout, I would recommend 2 to 3 every day until you see your gout symptoms disappear, then go down to 1 a day and maintain it, just like I do every day. This is the medical journal of nutritional biochemistry. Now we've gone from Guggul. We're now going to go to a vitamin. The exploration of the relationship between high uric acid levels, which is called hyperuricemia, gout, and vitamin D deficiency. This study utilized 2 large sample groups to explore the correlation between high uric acid, gout, and vitamin D deficiency. Our findings suggest that gout patients exhibit a much higher prevalence of vitamin D supplementation and vitamin D deficiency. Our findings consistently revealed a significant positive correlation. It is directly correlated among high uric acid, gout diagnosis, and vitamin D being low across both groups of people they evaluated. The restricted cubic spline showed a positive relationship between uric acid levels and the risk of vitamin D deficiency, and we found a nonlinear dose-response relationship in the sample. As it goes up, the vitamin D level goes up, the gout goes down. As the vitamin D goes down, so does the gout and uric acid levels go up in their diagnosis. Notably, our analysis revealed that approximately 30% and 37% of the total effect of gout on vitamin D deficiency can be attributed to the uric acid levels and BMI respectively. So they're saying as BMI goes up and as their uric acid levels go up, their vitamin D deficiency continues to spiral downward. Uric acid can directly inhibit 1-alpha hydroxylase expression in your kidneys, tubules, and reduce vitamin D concentrations in high-level uric acid rats. So they're telling you uric acid levels, if they're elevated in a mammal, they have found that when that's high, it reduces the function of the kidneys, which then reduces vitamin D concentrations in the animal or the human. Both high uric acid levels and gout induce the production of inflammatory markers called cytokines, and they list them there: interleukin-1, interleukin-6, tumor necrotic factor, and related reactive oxygen species, oxidative stress, and activate osteoclast activity, which destroys bone, and inhibit osteoblasts, which build bone, ultimately leading to bone loss. Ask your doctor if uric acid levels staying high, gout flares with your drugs, which increase uric acid, leading to bone loss. Ask them if osteoporosis is right for you. Vitamin D regulates bone formation, resorption, and overall skeletal mass, ensuring a delicate equilibrium between bone turnover and growth. Previous studies have identified the association between high uric acid levels and gout and osteoporosis and osteoporotic fractures. Yeah, they already know this is a link. There's already a link. Findings across various methods underscore the reliability and significance of our results, bringing us closer to understanding the intricate interplay between gout, high uric acid levels, which I used to suffer from, and vitamin D deficiency. Ask your doctor if vitamin D is right for you if you have gout. In conclusion, combining 2 large research studies allowed us to arrive at the finding that high uric acid levels and gout were both strong indicators of increased risk of vitamin D deficiency. Our findings highlight the causal effects of gout-associated genetic variants on vitamin D deficiency. So they're trying to blame gout causing vitamin D deficiency and not the reverse. And that's okay, because now we're going to show you what vitamin D deficiency does, and then when you supplement it. So this is from the Journal of Clinical and Translational Endocrinology, the study of hormones. This is 2021. Very relevant. It's only 5 years ago from this recording. Vitamin D supplementation is associated with blood uric acid concentrations in patients with prediabetes and gout, called hyperuricemia. In the present randomized controlled trial, we have shown that vitamin D supplementation is associated with a reduced amount of uric acid in your blood in patients with prediabetes and gout. What? Anybody out there listening to me, if you know somebody diagnosed with gout, have they been told by their rheumatologist to be on vitamin D? And if not, I'd like to know why not. Are you seeing an incompetent, uninformed medical doctor as your specialist for gout? I would be pretty upset to find out this information is published in medical journals around the world, and Dr. Ardis can dig these up and bring them to you in the Dr. Ardis Show, but your medical doctors aren't reading the research. What are they doing outside of practice? They're not studying, it looks like. We applied mediation analysis to prove that circulating uric acid levels and vitamin D concentrations in the blood may be reciprocally related, meaning if uric acid levels are high, we want to know if vitamin D levels are low. And if vitamin D levels are high, is uric acid levels low? Reciprocal. Moreover, changes in the concentrations of both vitamin D and uric acid were demonstrated during vitamin D supplementation. Taken together, these results suggest that vitamin D may reduce serum blood level uric acid concentration. Holy crap, what? You're welcome. I'm so grateful for you just even hanging in here and listening to this. But anybody with gout, you should know this. I wish I would have been told this. I would have not suffered with gout for 10 years. I'd have started taking this stuff before I even learned about the foods, which I will teach you last year. Uric acid has been associated with a number of metabolic disorders. For example, high levels of uric acid in the blood is frequently higher in patients with type 2 diabetes and non-alcoholic fatty liver disease. The average blood uric acid is a strong predictor of the development of prediabetes also, and gout is associated with a number of adverse effects in patients with diabetes, such as atrial fibrillation. At least a study has examined blood levels of uric acid in specific Asian ethnic groups and found that there are higher concentrations of uric acid in Chinese compared with Indians and Malaysian individuals. Our findings in the study they report are supportive of the role of vitamin D supplementation in reducing blood levels of uric acid in Asians with higher fasting plasma glucose, higher blood sugar levels, which may be a risk factor for developing metabolic syndrome. And if you don't remember this, metabolic syndrome is very specific and millions of Americans have it. It's any male or female who has a large waist circumference, high blood pressure, and high cholesterol levels. That is what they call metabolic syndrome. All right, so that's vitamin D. If you're wondering if vitamin D is right for your loved one with gout or you, it is. If you're a woman and your husband has gout issues, big toe pain, get vitamin D for him, get Guggul for him, you can get rid of the whole problem. This is another medical research study titled the American Journal of Clinical Nutrition. It's titled The Effects of Vitamin C Supplementation on Gout Risk. Results from the Physicians Health Study 2 trial. In this population of male physicians, we found that treatment with 500 milligrams a day supplemented vitamin C was associated with a lower risk of new gout diagnosis. What? Has your rheumatologist told you that? Ask your rheumatologist if vitamin C is right for you at 500 milligrams a day, which it is. The effects of vitamin C on gout were modest, meaning it made some improvement. Effects were greater in adults with a normal BMI. If you weren't obese, the effects were greater with vitamin C on gout. Elevated blood levels of uric acid is one of the most important risk factors for gout. Observational studies have demonstrated an inverse association of blood level vitamin C intake, you're supplementing vitamin C, with serum urate. The word ascorbate before vitamin C, by the way, there, ascorbic acid is another name for vitamin C. So they just called it ascorbate. So they're telling you here, with serum urate, animal models have demonstrated that vitamin C lowers blood levels of uric acid, called urate, by inhibiting urate synthesis, making more uric acid. Vitamin C lowered serum blood level urate by increasing the fractional clearance of urate through the tubes in your kidneys, by the way. Remember we talked earlier, I made it real simple. I said uric acid is converted into urine in your kidneys. That's what they're getting to right here. Vitamin C increases your kidney's ability to clear uric acid and turn into urine and pee it out. In a multi-analysis of trials testing vitamin C at 500 milligrams a day for 30 days, predominantly in adults without gout, despite substantial heterogeneity, vitamin C reduced people without gout's uric acid even by itself. That's already been proven in 30 days alone. So to prevent gout, take vitamin C. If you are one of few, hopefully, that believe that gout is a genetic disorder you inherited from your family and you believe it's going to happen to you because someone else has it, you should probably start taking vitamin C, vitamin D, and then Guggul, as we just showed you. Large vitamin C trials of adults without gout, uric acid, urate lowering effects were greater in those with high levels of urate at the beginning of the study. They saw the greatest reduction in those who had the highest amount of uric acid before starting vitamin C. In adults with gout, a small pilot study suggested a mild pre-post reduction in blood levels, uric levels from vitamin C. Our study showed a reduction in gout risk. Our study showed a reduction in gout risk with vitamin C supplementation. The potential for vitamin C to reduce gout risk has been suggested in a large prospective cohort study in which dietary vitamin C supplemented was associated with a lower incidence of gout. It's already been done in humans. However, our study represents the first evidence from a large randomized trial that vitamin C supplementation might reduce new diagnoses of gout. So remember, I showed you at the very beginning of this PowerPoint presentation and podcast that they're going to go from 50-something million people in the world right now have gout. In the next 30 years, from 2020, they said it's going to be over 90 million people worldwide have gout. This study tells you what the world should do to reduce those who are going to be diagnosed with gout, new diagnoses. Vitamin C supplementation might reduce the new diagnosis of gout. Oh my God. Okay. Not the prescription drugs for gout that are currently FDA approved and on the market in your pharmacy. No. Vitamin C is being suggested to be a preventative measure against being diagnosed ever with gout. So let's put the world on notice, everybody. Tell all your medical professionals, tell all your health associations you're a part of, tell your government elected officials to start encouraging all citizens in your country to take 500 milligrams of vitamin C every day, as I have told you for the last 5 years. Our data suggested vitamin C could be more efficacious in preventing gout in adults with a normal BMI. So the healthier you are, the better the effects of vitamin C. It is possible that 500 milligrams a day is an inadequate dose for adults with higher BMIs. You can take up to 5 or 10, I would actually recommend up to 5,000 milligrams a day of vitamin C. And we have Immune C at the Dr. Ardis Show. Notably, several prospective studies have observed lower gout risk and even higher vitamin C intake, like I just mentioned, suggesting that 500 milligrams a day might not be adequate, even in general populations. 500 milligrams is a really small amount. Most people recommend 1,000 milligrams up to 5,000 milligrams. And if you've ever seen emergency little packets, that's 1,000 milligrams. That's twice as much as these studies. When I just said up to 5,000 milligrams a day, that's what I do every day. If I recommend anything to anybody, vitamin C, it is 5,000 milligrams a day. Vitamin D is 5,000 international units to 10,000 international units a day. One dose of our vitamin D3K2 is 5,000 international units. 2 doses is 10,000, which is adequate to help with gout. This is from the Arthritis Care Resolution Medical Research Study. Effects of oral vitamin C supplementation on blood levels of uric acid. This is a meta-analysis, multiple analysis of randomized control trials, medical trials. Overall, vitamin C supplementation reduced serum uric acid levels with an average effect of lowering it by 0.35 milligrams per deciliter in the blood. Although only 6 of the 13 trials reported significant reductions in blood levels of uric acid, pooling these small trials made it possible to estimate an overall effect. These findings support the observed inverse association between intake of dietary and supplemented vitamin C and blood levels of uric acid. The more vitamin C in all these trials that people took, the lower their uric acid levels went. We can publish that. So ask your rheumatologist if vitamin C is right for you. And vitamin D and Google. In vivo studies in human trials suggest that vitamin C has uricosuric properties. This is awesome. Uricosuric properties. This is a part of the converting uric acid into urine in your kidneys. Increasing renal fractional clearance of uric acid, thereby reducing blood levels of uric acid. Vitamin C has already been proven in human trials to make the kidneys better convert uric acid into urine and eliminate uric acid crystals to reduce gout symptoms. Vitamin C may act specifically at uric acid reabsorption sites in the parts of the kidney they're talking about here. They're describing to you how it works in the kidneys. It is also possible that vitamin C increases glomerular filtration rate. What? Okay. eGFR is how they measure whether or not the kidneys are clearing themselves, and they'll often put you on a water pill or a diuretic, which is why this is indicative of gout. Remember, those drugs that do that cause gout symptoms. Okay. Vitamin C increases your kidney's ability to release water. So you don't need a water pill. You just need vitamin C. You don't need Lasix or hydrochlorothiazide prescribed to you. Vitamin C does this. It's already proven to increase glomerular filtration rate, to remove water retention, edema, and blood pressure. It's amazing. As an effective antioxidant, vitamin C decreases free radical-induced damage to body cells, thereby reducing production and ultimately blood concentration of uric acid. Everything related to gout. This is the significance and innovation of these studies. Controlled trials resulted in a significant reduction in serum uric acid levels. On average, 0.35 milligrams, which is a big deal. Reductions in serum uric acid levels were larger among trials administering 500 milligrams a day of vitamin C or greater. I recommend 1,000 to 5,000 milligrams. Anybody on gout, you might want to go up to 5,000 until your gout symptoms disappear, then go back down to 1,000 every day forever. There's another research study in the Journal of Rheumatology. So if you're seeing a rheumatologist or you know somebody with gout who is and being given those drugs we talked about earlier that are known to increase your risk of gout, you might want to show them this study and then have them take it to their rheumatologist. Imagine how we could transform the American landscape if we can get more rheumatologists understanding the literature. This is published in 2010. So they should have known this by now if they don't. And if they're not telling you to take vitamin C for gout, I'm really sorry. They are ignorant medical professionals and they are uneducated. That's what it means, ignorant, uneducated. Vitamin C intake and blood levels of uric acid concentration in men. Remember, men are the ones that are most likely getting it, gout. In men without high blood pressure and a BMI less than 30, we found intakes of vitamin C to be inversely related to the amount of uric acid in their blood. The more vitamin C they took, the lower the uric acid went, independent of their diet and other risk factors for gout, such as BMI, age, and alcohol intake. It didn't even matter if we looked at their alcohol intake or their obesity or their diet. We found that if you give them vitamin C, we saw it works. It's amazing. The associations were largely derived by vitamin C supplemented use. Medical doctors have proven and research has proven vitamin C works as a supplement to reverse gout and uric acid levels. Our results show that total vitamin C intake of 500 milligrams per day or higher is associated with a lower level of serum uric acid relative to those who took less than 90 milligrams a day. You take 90 milligrams of vitamin C, it doesn't do as much as if you take 500 milligrams or more of vitamin C. Supplementation with vitamin C as low as 500 milligrams a day for 2 months reduced blood level uric acid by 0.5 milligrams per deciliter, compared to no change in the placebo group that was not taking vitamin C. This level of population average difference of blood uric acid levels can be translated into a clinically relevant difference in the risk for incidence of gout flare-ups or being diagnosed with gout. They're telling you these are clinically relevant numbers in these studies. And if applied clinically, it would transform the lives of those who have gout or those who are trying to prevent gout. One daily serving increase in beer was associated with an average blood uric level increase of 0.4 milligrams per deciliter. If you want to increase your risk of developing gout flare-ups, please drink alcohol or beer. With a 50% increased risk of incident of gout for every beer you drink. Increase your beer intake, increase your gout risk. So anybody out there who likes gout, being a part of their gout Facebook group, those who like to be victims and complain about their pain because that's the only way they get attention, please drink alcohol. You will increase your risk of gout. Also, get the prescriptions at your local CVS and Walgreens your doctor writes for you, because I just showed you 77% increase in gout flare-ups with those drugs, 45% increase with another drug, Uloric. Yeah, ask your doctor if those are right for you. If you like being a victim, those are right for you. These population-based data indicate that vitamin C intake is inversely associated with blood levels of uric acid. These findings support a potential role of vitamin C in the prevention of hyperuricemia and gout. Lowering uric acid and gout, vitamin C does it. Here's another one for you if this hasn't driven it home yet. Vitamin C intake and the risk of gout in men. Another study, we found that the risk of gout decreased with increasing vitamin C intake, up to 45% lower risk at the top vitamin C intake category, which was 1,500 milligrams a day or more. Those who took that much, could you imagine reducing your gout flares by 50%? You didn't see that number in any of the prescription drugs for gout. These associations were independent of their diet. They didn't change anything in their diet, which is super important. I cured myself of gout with diet changes alone 20 years ago. They're telling you here. We just had people take vitamin C, and oh my God, the more vitamin C they took, they reduced. If you got to 1,500 milligrams a day of vitamin C, you reduce the risk of future flare-ups by 45%. A gout sufferer's life will be transformed if you can cut in half the amount of gout flares they have. Please tell your loved ones about vitamin C and this broadcast. These associations were independent of diet and other risk factors for gout, such as BMI, age, high blood pressure, diuretic use, which I showed you earlier is a risk factor for developing gout, alcohol, and chronic renal failure. Remember the conversion of uric acid to urine in the kidneys. The uricosuric effect of vitamin C is likely due to a competition of renal absorption of uric acid via an anion exchange transport system at the proximal tubule. These are kidney tissues. Furthermore, this recent randomized trial showed vitamin C at 500 milligrams a day significantly increased the glomerular filtration rate. If you see EGFR on your blood work is low, that means they're going to put you on Lasix and make you pee. Vitamin C increases glomerular filtration rate. You're welcome. Providing another potential mechanism for this uricosuric effect of vitamin C intake. Potential cardiovascular benefits of vitamin C may be particularly relevant among gout patients, given their increased risk of developing heart disease and death. Given the general safety profile associated with vitamin C, because it's so safe, within the generally consumed ranges as in our study, less than 2,000 milligrams, vitamin C may provide a useful option in the prevention of gout, says medical research studies published by the NIH. You see, that's where it is down below. Now I want to talk about this. All right. You all should know, I just released our new Hydrate Complete product. This is from summitrheumatology.com. This article is titled, Dehydration Can Create a Trigger. Gout trigger. Did you know gout can be triggered by dehydration? Did you know Hydrate Complete is to reverse the effects of dehydration? Ask your doctor if Hydrate Complete is right for you, because it is. And here is our Hydrate product. We have it now in all natural flavors, and it's all natural ingredients. We have blue ice, which is like blue raspberry, glacier, you name it. You've got apple, green apple, and strawberry lemonade. All natural flavors from those fruits, by the way. It is delicious. Get yours now. If you got gout, you should be on it. This is our Clear Skin Complex. I want to highlight on the screen. Second image on the screen, you'll see Guggul Resin Extract is the second ingredient in there. Clear Skin Complex, by the way, the reason why people might think this is just for acne and skin. Every ingredient in here for resolving acne issues, Clear Skin Complex, everything in there. DIM included, Guggul included, detoxes the liver naturally, which is how you improve uric acid levels, which is why I made sure this was in here. Remember, we have our Guggul Resin Extract at our website. If you don't want to use Clear Skin Complex, that's fine, but it is really, really effective for the liver. It's just targeting the liver to improve the liver's production of any inflammatory markers, including acne, gout, you name it. This is our vitamin D3K2, and you see vitamin D there at 5,000 international units a dose. This is our immune C product, vitamin C and ascorbic acid. You'll see there at 1,000 milligrams per dose. Now, when I started this, I told you I cured myself of gout. For those of you with gout, you should know this. The foods you're eating cause gout. I just showed you mineral and vitamin deficiencies and an herb called Guggul that can help reduce gout flare-ups and prevent it. Those are food items. In the world of gout, your rheumatologist should teach you that there are what are called low purine foods and high purine foods. Foods that are considered high purine foods are those foods when you eat it, chew it up and swallow it, and goes into your liver, it produces higher amounts of uric acid in your blood to lead to more gout flare-ups. So high purine foods is what you want to avoid. Those that are low purine foods are the ones you want to be eating. So look at the list I'm about to put up here. These are low purine and high purine food charts. There are many more lists of these, more comprehensive. There's even books written about these foods for people with gout. You can go buy them online. But I want to show you real quickly what are some of the foods known that increase your risk of developing gout. For me, it was red meat. If I ate more than 10 ounces in one setting, I would get gout. If I eat less than that, if I eat 8 or 10 ounces at a meal or less, I will never develop a gout symptom. I haven't in 20 years. So I just never eat more than 10 ounces. Steak, ever, beef. That was mine. All right, so let me show you some of these foods. All right, so they're in columns. You'll see eat on the left, limit these foods in the middle, and avoid the high-purine foods on the right. So if any of your loved ones have gout, they need to be avoiding alcohol. They need to be avoiding anchovies, cod, duck, goose, and they should be eating almonds, bread, eggs. I would prefer sourdough bread, by the way, and gluten-free bread. Lima beans, garbanzo beans. These are low-purine foods. To avoid, you need to avoid gravies, haddock, herring, mussels, and organ meats. These are high-purine foods. You should be eating and not avoiding low-fat cheese. Now, I will tell you, cheese is known to be a high-purine food, but you're talking about your cheddars, your mozzarella. You need to avoid that. When I was 20 years ago, when I learned from an endocrinologist, they only talked about 3 foods that caused gout: red wine, cheese, and red meat. And I looked at my life and I'd never drank at that point. And I was like, hey, cheese I like, steak I like. Maybe I could just reduce my beef. And that was the cure. Low-fat cheeses, they tell you, don't cause it. And they're low-purine foods. I personally would tell you, avoid cheese or reduce your cheese intake, period. Then they tell you, for all people with gout, you should be eating more fruits and vegetables. Pasta is a purine food causing uric acid. Peanuts and peanut butter, I would avoid peanut butter at all costs, and peanuts. I would say no to that. Rice is a low purine food for sure. Then you also need to avoid all those with gout. You should avoid salmon, sardines, scallops, tuna, and yeast extracts. On the left, you should be eating or consuming skim milk or whatever. I actually would not recommend that either. Sunflower seeds, yes, that's fine. Sweets, oh my God, that's so funny they put that on there. It is a low purine food, but I do not recommend sugar. Walnuts, and then they recommend yogurt. Just say no. So red meat, you didn't even see in the list. These are just some of your highest purine foods. Know which to avoid. Go download Purine Foods. Go buy some books. You'll learn. There you go. I don't know why it's repeated. All right. I'm Dr. Ardis. This is the Dr. Ardis Show. Scan the QR code. Download the PowerPoint at the resources tab at the Dr. Ardis Show. Share this far and wide. There are answers to gout, and we have them at the Dr. Ardis Show. All right. And also, final thing to present. This is our book. I hope you got it for COVID-19. Go get it. Moving Beyond the COVID-19 Lies is still an Amazon bestseller to this day, a year and a half later, and it's very, very exciting. I hope all of you and your medical professionals and healthcare providers you love, trust, and admire and adore have a copy. Go get them one. I am Dr. Bryan Ardis. This is the Dr. Ardis Show. This is the natural solutions to gout and all of the worrisome side effects, including gout flare-ups known to be caused by the drugs they prescribe for gout. I'm Dr. Ardis. Ask your doctor if vitamin C, vitamin D, Guggul, and hydration are right for you. Get your Hydrate Complete today at the Dr. Ardis Show. I'm Dr. Ardis. God bless you. We'll see you next time on the Dr. Ardis Show. Thanks for watching this week's episode. Visit thedrardisshow.com/follow for my official social media channels and free healing resources. Beware of fraud accounts. Neither I nor my company will ever ask you for money, crypto, or personal information through your social media or DMs. Like this video and share with a friend. And if you're not already, subscribe and follow along so you don't miss any updates from me, the only real Dr. Bryan Ardis. And remember, nature always wins.